My name is Joe Peroni, and this is the Rise Above Project. And today we're going to talk about ADHD. ADHD and ADD tend to be very controversial subjects. So we're going to take a look at this today. And at the end, I think I'm going to offer you what I think is the best treatment for ADHD. Now, there's a lot of professionals in the field that conceptualize ADHD as a neurodevelopmental disorder, or you can call it an organic brain disorder. And in order to treat that, we need amphetamines, such as Ritalin and Adderall. Now, there's other professionals that don't believe it's a disease at all. They believe it's just a clustering of symptoms due to their environment. And then, of course, you have the other professionals that are somewhere in the middle, that they believe that ADHD can be real, but more often than not, it's overdiagnosed. So as a mental health clinician, I'll give you a little example of this. Now, I've had a lot of examples, so let me try to just knock it all down into one story. I had this one client that was brought to me. He was 6 years old. His mother brought him to me. And the thought was at the time that she wanted him diagnosed with ADHD because she was told that he had that at the school that he was in. And he was showing all the symptoms of this. Now, it's a good thing that she came to me first, because if she had gone to a psychiatrist first, psychiatrists do not, at least to my knowledge, maybe somebody does, but more often than not, they don't do therapy with clients anymore. They just administer medications. So we're looking at a 6-year-old kid that could have been just thrown on psychotropic meds because he met the criteria for ADHD. So as I was talking to this child and giving him the assessment, and I'll give you an example of what an assessment looks like here. Some of these questions would be, do you have a short attention span? Do you make careless mistakes? Can you finish activities that you start? Do you lose things? Do you forget to do things? Are you easily distracted? Are you able to listen? Are you disorganized? Are you overly active? Do you talk a lot? So we're looking for things like hyperactivity. We're looking for impulsivity. In going through the list, this child, of course, would have met the criteria for ADHD. But then we look a little further. And what happened a couple of weeks prior to this is that his mother and father were separated. And the father left the house, and he was living only about a half a mile away from the house, which was very close to the school. Now, every time this child was taken to school, he didn't care about his homework. He didn't care about learning whatever you learn at 6 years old. He was trying to leave the school because he knew that he could run the distance from the school to go visit his father. And that's what he wanted to do. So his mind through the whole day was, where's my father? I want to see my father. I want to see my parents together. And so here we're looking at a situation where, again, ADHD, there's a lot of carryover to your environment or to trauma. So in this situation, I could have diagnosed him with adjustment disorder. But there's a problem when you diagnose a child with adjustment disorder. First of all, the lack of money from that, because now he's not a candidate for drugs, and he's not a candidate probably for long-term therapy. So again, this is a problem. Like, even if you Google ADHD, is it real, you're going to get a lot of people and a lot of organizations, medical doctors, who, by the way, medical doctors are not mental health clinicians, and they're the ones who do a lot of the diagnosing for ADHD. Why? So they can prescribe drugs, but they don't really know about all of the extenuating circumstances that can lead a child to be easily distracted, forgetting to do things, being disorganized. So we end up over-diagnosing people. So I'll show you how I feel about this subject. Is ADHD real? Well, I'm not going to say it's not, because anything can be real, right? Of course it could be. So I'm not going to say it doesn't exist. I'm going to say that I very rarely, if ever, see it, though, because there's always extenuating circumstances behind it. So as we're trying to look here to drill down more about what to do about the symptoms of ADHD, let's take a look at a couple of facts. So let's look at the prevalence of ADHD. In 1997, it was about 6%. In the year 2016, it was 11%. Now, a lot of the people who believe that ADHD is a neurodevelopmental disorder, they also believe that it's genetic. Well, if we're looking at a period here of about 20 years where the prevalence of ADHD almost doubles, is it possible that it's genetic? No, genetics doesn't work that fast. So that's not the answer. It doesn't mean that it's not genetic. It just means that most likely in this situation, there is no way that the prevalence could double in 20 years, and we could say that it's only genetics. Now, there are more people that are aware of ADHD, and more people would diagnose it. That's true. However, we're also looking at the symptoms, and we're not looking at the root cause. The other thing that's interesting here is that during COVID, the ADHD symptoms of children and adults included skyrocketed. So if it's an organic brain disease, is it triggered by COVID now all of a sudden? Is it triggered by people staying at home all the time? Because that doesn't make sense, right? So it's possible that it's a brain disease, but if we're looking at ADHD symptoms as a brain disease, should it explode or skyrocket during COVID? No. So there's a good chance that it's being overdiagnosed. Let's look at this also, because when we look at ADHD diagnosis, we're looking at there's more boys than girls who have it. Why would this be? Well, we don't know the answer to that, really. Why are more minorities diagnosed with ADHD? And why are more economically disadvantaged children diagnosed with ADHD? Could it be the stress? Because again, if you have parents who are stressed out, that would lead to the child being stressed out, and then you would see all of these symptoms. Again, such as not finishing activities that you start because you're thinking about other things, you lose things, you forget things, you're easily distracted, short attention span, making careless mistakes. All of this can evolve out of a very stressful environment. So if we want to look at ADHD and we're contemplating whether we should use psychotropic meds on, let's say, even an adult or sometimes as a child at 6 years old, one of the things that I would like to know is what is the number one test that could be administered to determine ADHD, right? I want to know what that test is. And then we can take a good, honest look at what's happening here. Well, there actually is no test to determine ADHD. There's no blood test. There's no x-ray. The gold standard test to determine ADHD is an interview. Or said in a better way, maybe, it's a self-report. Sometimes we're doing a self-report with a 6-year-old to determine if that child is going to be on drugs or not. And of course, at very young age, we can be interviewing or assessing with their parent. And so again, it's self-report. We're asking the question, we're receiving an answer. That's it. There's no science behind this. And yet, we're going to throw drugs at a child. I'm not saying it's wrong all the time. I'm saying we need to take a really good look at this. So let's take a look at this a little bit more, because the proponents of ADHD, and I was thinking about doing another show on this to challenge this one doctor that was talking about it. They really twist themselves in knots sometimes, trying to tell you things that just don't make sense, and they try to explain it. Like The big one that they try to explain is that these kids can't concentrate, they lack focus, they can't do schoolwork, these types of things. But yet they can play video games for 12 hours a day. How does that work? Well, right away, that whole argument crumbles that they can't concentrate on anything, you would think. But there's a lot of psychiatrists would say different. What they say is that there's a lack of dopamine. And these kids with ADHD need instant gratification, and they're not really set up brain-wise for long-term goals. Okay, so let's say we buy into this. All right. So they're trying to tell us that a kid who plays video games for 12 hours in a row, almost every day, is getting their dopamine hit and release from video games, but he can't get it from other areas. So the video games hold his concentration, but other things don't. And he's also might be more prone to doing drugs down the line because he wants that dopamine hit. So is it a dopamine problem? I would say that it's a priority problem. It's a meaning and purpose problem. Because you can actually get a dopamine hit by not doing anything. You can get a dopamine hit by even thinking about doing something. So, for example, if a child is enthralled with video games, they'll get excited with the thought of leaving school to go play a video game. Just the thought of getting in front of that screen to play is enough to get a dopamine hit. But is that normal in a child's development? It shouldn't be, because the child should be able to get a dopamine hit from hanging out with friends, talking with people, playing games, running around, playing tag, playing football, reading, learning, doing things. So you can get a dopamine hit from anywhere. I'm going to say that there's something wrong with the kid's environment if video games are the only thing that gives them a dopamine hit. The other thing that they're not understanding here is dissociation. They think that a kid is playing video games and they're concentrating for this whole 12 hours. I would challenge that. I would say that they're just sitting there mindlessly. Again, because that doesn't give them real meaning and purpose. Now, if you can't see that as being a truth, look at this, for example. As adults, I think we've all done this, right? We take our car. It's about 3,000 pounds of glass and metal. And we can fly down the street at 40 miles an hour, sometimes 65 miles an hour, depending on the road. And we go from point A to point B. And we've done it so many times, we don't even know how we did it. We just get to our destination, we turn the car off, and we don't remember all the details. Well, because we're dissociating, because we've done it so many times. It's not that we're concentrating that hard. And so I would challenge that too, that these kids are actually concentrating on their video games. I would say they're dissociating. So there's a couple of things we have to look at here. Is that, yes, they are doing things for a long amount of time. Are they really concentrating on it or not? Either way, I would still go back to the beginning and say it's a prioritization problem and it's a meaning and purpose problem. So what would be good treatments of ADHD? Now, I'm not just saying for sure that it's an actual problem. Maybe we're just talking about the symptoms. So if you look at the drugs, what the drugs do is that they don't actually go for the root cause of the problem. They are just going to diminish the symptoms. So you could say sometimes it's possible that the drugs work. They can diminish symptoms, not all the time. But they're diminishing the symptoms, they're not taking away the root cause of the problem. That's why sometimes, or most of the time, what is suggested is therapy, talk therapy. So here we're looking at behavioral therapy. Now, we're trying to improve somebody's behaviors. We're trying to make them have productive behaviors. And any unproductive behaviors that were learned can be unlearned. So when we look at that, does this really seem like we're dealing with an organic brain disease, or we're just reparenting kids here? I'll let you think about that. The other line of defense that we use is CBT, which is cognitive behavioral therapy, where we look at the thoughts, which the thoughts lead to a feeling, and then the feeling leads to a behavior. So what we do here is we challenge irrational thoughts. We try to make them have better thoughts. We try to have them to where they don't catastrophize, that they don't just magnify the negative in situations. So again, we're trying to improve their skills in terms of how they think, which is really nothing more than common sense when you get down to it. So we're teaching common sense to overcome a disease. I don't know, that's a good question there. Like, is it possible to use common sense to teach people to overcome a disease? So is it really a disease? Like, if you have cancer, can somebody just teach you a different thought process to make the disease go away? It's a good question. So here's what I think is the number one way to deal with ADHD. Not just the symptoms, but I think it can get at the root cause. Why? Because the brain has plasticity, and it can learn, and it can do things on its own. After all, if you push it repetitively enough, it will change. So regular exercise. What does regular exercise do? Well, it decreases the hyperactivity we were talking about. It decreases mood disorders. It increases productive thoughts, improves behaviors. It manages moods, typically better than just talking about it does. But there's specific exercises to do. Now, any exercise will work, right? Running, jumping, I don't care, whatever it is, go out, have a child play to exhaustion, and then when they can't do that anymore, have them do it again, and have them do it every day. That's what kids are supposed to do. We end up chaining them. They're not allowed outside anymore. What do you think is going to happen? Again, going back to the beginning of the show, why do you think all these ADHD symptoms just exploded during COVID? Because their normal sedentary lifestyle got even more sedentary. Their social isolation that most kids are dealing with today got even more socially isolated during COVID. So it makes sense that ADHD in some ways is a disease of civilization, the way it is today. Let's be more specific about the exercise. Let's look at things such as boxing, gymnastics, weight training, dancing with a partner, like ballroom dancing, tennis, whatever it might be, racquetball. And some of these that I mentioned are important because it takes two people. And what you're doing is that you have to concentrate hard on what somebody else is doing so you can react to that. Now, what does all this do? It does everything that behavioral therapy does, right? It's going to improve your behaviors, especially if you like the sport. So now you're going to get more committed to doing it. And sometimes you're going to lose, and you're going to learn about adversity. And again, you're going to learn about how to control your thoughts. You're going to learn how to control your feelings. You're going to learn how to improve your behaviors. All of this is going to happen naturally. Sitting in a room with a clinician telling you to do things and challenging you on your quote-unquote irrational beliefs, it works to only a degree. But it works even better when the client learns how to do it on their own because they're actually engaging in life. Now, the more intensive the sport, the more that you're dealing with another human being that you have to react to, the better that we're going to be able to handle these ADHD symptoms. Now, I want to read you something here, and I want to read this because it was said so beautifully that I don't think I could off the top of my head say all of this. I could probably write it out if I took the time, but I don't want to miss any of the words here because, like, again, it was said so well, and it makes such a great point. This is specifically towards boxing, but you could use it for almost anything where you're having two people compete in a sport. And even in weight training or bodybuilding, it's one person, I understand that, but your adversary is a barbell. I don't know anybody in all the years that I've been doing mental health work or working with clients in terms of being a personal trainer, nobody in the middle of a bench press or a squat said, oh my God, I'm so bored right now and I just can't pay attention. I'm gonna let this bar fall on my neck. Nobody's done that. I've done boxing a lot of my life. Nobody in the middle of a boxing match said, oh, I'm having trouble concentrating. Hit me in the jaw one more time and let's see if I can learn to keep my left hand up. Nobody says that. It doesn't happen. So again, if you're going to try to talk ADHD symptoms down, you're gonna have a problem. If you're gonna medicate it, the problems are always still gonna be there underlying. But you can have people be stronger people by teaching them actions that will have all these ADHD symptoms diminish. So let me read this. Boxing is a high-intensity sport that requires total mind and body involvement. You have to be aware of your surroundings, your opponent, and your own body movements, along with being able to regulate your emotions in real time in order to not lose control and fight effectively. All of this has a positive effect on your own personal ability to manage ADHD. Let's now talk more in depth about how the benefits of boxing and training involved help with the different aspects of ADHD. Number one, concentration. During activities such as hitting the bag, pad work, and most importantly, sparring another human being, you have to remain focused on the activity at hand. There is no time to let your mind wander when you are sparring against an opponent, as you have to be ready to respond to their every move. This level of concentration required is practiced during activities such as hitting the bag or pad work, and the thought of being punched in the face if you don't stay focused provides all the added motivation you will ever need to develop this skill. Over time, you will become more adept at being able to turn on like a laser-like focus when the situation requires it. The process of actively working on maintaining concentration during training leads to the brain developing more neural connections for this ability. Again, the brain has plasticity, meaning you are able to apply your concentration to other tasks that are not related to boxing. Boxing training is a brilliant activity to do before activities such as studying or work that requires concentration, as it releases endorphins and dopamine, which makes the mind more alert. Let's talk about impulsivity. Boxing can help you to manage ADHD symptoms such as impulsiveness, which can often lead to people doing things that they later regret because they didn't think about the consequences first. Again, thinking about the consequences first goes back to behavioral therapy or CBT. But again, can you talk somebody into it? Maybe, but it's better to use activity. Let's continue. Boxing training helps you to control your impulses because you have to have a very high level of self-control when sparring or fighting competitively. You can't just throw punches aimlessly without thinking about what you're doing, because you waste energy and make yourself more vulnerable to be counterpunched. Likewise, you also become able to stop yourself mid-punch in situations such as sparring if the situation requires it. This self-control can carry over into other areas of your life, such as when you come into conflict with other people. As with concentration, your brain develops neurologically, providing you greater impulse control abilities. I'm going to read a little bit more, but doesn't this sound better than putting your kid on drugs? You know the answer to that. Let's talk about hyperactivity. For kids who have ADHD and bundles of energy, boxing training is one of the best ways for them to burn it all off, as boxing training is one of the most energy-consuming workouts you can do. It makes use of all three of the different energy systems to include aerobic, anaerobic, and PCR system. For adults with ADHD who no longer have the hyperactive aspect, boxing training is a great way to help alleviate in the internal feeling of restlessness. Emotional regulation. One of the biggest challenges for people to manage ADHD is being subject to extremely high intensity emotions. In particular, that anger or rage when upset. This often causes problems, in particular when it comes to social interactions and handling conflict. Boxing training helps you to learn to manage your emotions because you have to be in control of your anger when you're boxing. If you get too angry, you won't be able to think straight and you can make a mistake that gets you hurt. In particular, developing the ability to not act on your anger is the first step to getting it under control. This ability is gradually built up during training when the person learns to tolerate and persist by the pain that is felt by certain exercises and activities. Further development in this area is provided from the activities such as sparring and works in relation to learning how to control the adrenaline released from the fight or flight response. And of course, it improves self-discipline. It's a safe alternative for other risk-taking behaviors. It builds confidence and self-esteem. And it can help achieve mini goals. Again, much better than sitting there playing video games, and so on and so forth. I don't want the show to get too long, but it probably already is. So hopefully that gives you some ideas of ADHD and ADD and how to deal with it. Again, it's your choice on how you want to deal with this. Again, if you go to a psychiatrist who makes money off of dispensing medications, what do you think that person's going to do? They're going to dispense medications. But there's other ways to deal with this, and you should look through it. Again, if this was a real brain disease, and I'm not saying it's not, it could be, but if it was a real brain disease, would it increase almost double in 20 years? Would it increase exponentially during COVID? Would it be mainly diagnosed in kids who have traumatic backgrounds, economically disadvantaged backgrounds, minorities, boys? Think about it. Hopefully this show has been beneficial to you in some way. My name is Joe Peroni. This is the Rise Above Project. Please subscribe and tell a friend. Thank you.